So hello friends, welcome to my new video. So today's topic for discussion is about neovascular glaucoma. So whenever you are doing in glaucoma department, many times you see some patients where some type of iris abnormality is there, and also new vessels are there, and sometimes as a trainee or mistakenly if you miss those type of signs, then it can lead to a blunder thing. Okay, so this is why I'm going to discuss in this matter today, right? So neovascular glaucoma means glaucoma which is due to neovascularization in angle, right? So why neovascularization happen? So if the patient, there is some type of disease or pathology that is responsible for happening of the neovascular glaucoma, like suppose the patient is having diabetes mellitus for a long period of time and it is actually not controlled properly, right? Or the patient is having central retinal artery or vein occlusion or retinal ischemia and those things where actually there is a activation of vascular endothelial growth factor is there. So this activation of vascular endothelial growth factor will lead to neovascularization in retina and also in elsewhere. So if it is continued for a prolonged period of time, it can lead to neovascularization of iris. So if this neovascularization reach to the angle, then it can actually block the aqueous humor outflow, right? So this will ultimately lead to increase of intraocular pressure of the eye. So the angle will remain open, but the trabecular meshwork is closed by those blood vessels. So this is why aqueous cannot flow out, right, and it will accumulate in the AC. So it will ultimately rise the IOP. So if this rise of the IOP remain for a prolonged period of time, then it can lead to certain damage in the optic disc. So it can lead to glaucoma in the latter, right? So here so this is why whenever you are examining the iris properly, so examine the iris with maximum magnification, right? If your slit lamp is having 40x magnification, just do a thorough scan with the 40x magnification and see any type of abnormality is there or not. And if you find that in the iris there is neovascularization formation is there, so always do prefer gonioscopy, right? And in gonioscopy you need to examine every angle, superior, inferior, nasal, temporal, and also document it properly. And before dilating the patient, also discuss this thing with your consultant. Okay, so don't take decisions by yourself. Okay, you are actually, we are optometrists, so our primary work is to examine the eye and also document it properly. So this why if you find something unusual in the iris and also neovascularization in angle, always do discussion with your consultant posted there, and so that the treatment options can be a good thing, right? So the treatment option that having in neovascularization of neovascular glaucoma is like prescription of what to say anti-glaucoma medication. But suppose by giving the anti-glaucoma medication, the IOP is not controlled. So at that time, what we actually prefer is we refer the patient to retina department or retina consultant, because if the neovascularization of the angle and iris is due to diabetes mellitus and diabetic retinopathy, so proper management of diabetic retinopathy is also very important, right? Where and so another thing that I want to tell you is in case of proliferative diabetic retinopathy, you will see neovascularization of the iris and angle, right? So this is why always send the patient for retina consult also, and there should be a good coordination between glaucoma consultant and retina consultant. So if there is some damage in the retina due to proliferative diabetic retinopathy, then there is pen-retinal photocoagulation can be done, right? And also there is a in many article it is also said that by giving the anti-VEGF injection, the neovascularization actually regress and IOP also controlled, but it is also seen that it is for a temporary period of time. So here further research is very much necessary. So one option is control blood sugar, pen-retinal photocoagulation, and giving the pen-retinal photocoagulation, giving the anti-glaucoma medication. So even after giving all those treatment options, if the IOP is not controlled properly, then the last step that can be taken is Ahmed valve implantation. So it is also mentioned in many articles. Okay, so before that we need to see what type of treatment option that we can give. But the main thing is, if the neovascularization of the angle and iris due to increase sugar level, then treatment of the diabetic retinopathy is very much important.